Hello everyone, welcome back to another episode of Raising Resilient Rookies with your baby doctor, Dr. Raksha. Let us discuss autism today. April is considered as an Autism Awareness Month. So why do we need to know about autism? Autism is a neurodevelopmental condition which has been skyrocketing in the recent past. So knowing a few subtle signs and symptoms of autism will help you identify this condition in children around you if it is present and encourage them to seek medical attention as early as possible. Autism or autism spectrum disorder affects how a child communicates, interacts socially, or experiences the world. It is also called as spectrum because the symptoms come in varied form. A few children will have mild symptoms to some may have very severe symptoms. Let us now discuss a few of the signs of autism. An autistic child does not respond to the name by 12 months of age. They have limited eye contact or facial expression. They have delayed speech or communication. They usually prefer to play alone, which is called a solo play, and have difficulties in understanding social cues. Most of the autistic children tend to do repetitive movements like flapping of the hand or rocking and have specific repetitive speech patterns. They are very resistant to any kind of change and have difficulty in transition. An autistic child has excessive sensitivity to sensory inputs. They get extremely overwhelmed by sound, light, texture, or even smell. There are a lot of myths surrounding why a child becomes autistic. It could be vaccines causing autism. The answer is no. Does parenting style or emotional trauma in the childhood can cause autism? The answer is no. And do screen time or excessive usage of gadgets can cause autism? The answer is again big no. So what causes autism? It is a combination of two important things. One is the genetic factors and second is the environmental factors. When we say genetic factors, it is the mutation or change in that gene which is responsible to brain development which results in autism. Also, environmental factors like the age of the parents when they have conceived the child. Like an elderly parent at the time of conception can also cause autism. Also, children who are low birth weight or premature babies or those babies who have some kind of infection which they have got it at the womb of the mother have increased risk of developing autism. Who diagnoses autism? Autism is diagnosed by a pediatrician or a developmental pediatrician who takes a thorough history, does developmental assessment and then diagnoses whether the child has autism or not. Also remember, we can diagnose autism as early as 18 months of age or earlier than that. So my dear parents and friends, always keep your guards up. If any child around you is showing autistic traits or any features of autism, kindly seek help. Right help at the right time with right kind of therapies will ensure an autistic child will have a secure and safe future. I hope this has been helpful and keep watching for more such informative content. Until the next time, bye.